Hi, I'm Andrew, and I'm working on my project management degree, so I'm super excited to launch the Health Hub project. The goal is dead simple. I'm trying to cut red tape and technology barriers for people to access healthcare, education, and other benefit programs. We're donating hardware such as laptops, tablets, blood pressure checkers, heart rate monitors, etc., to communities that could benefit, such as senior livings, refugee centers, Section 8 housing, and others. We'll be training staff on how to use the hardware to help their community residents access things like telehealth visits without leaving the building for primary care and urgent care needs. They'll be able to take their own blood pressure and pulse on the spot and get feedback from the provider about what those numbers actually mean. We want them to be able to scan important documents to us and other experts, like medical bills, that our AI team can audit and give them appeal letters, scan social security letters, be able to file their appeals online, renew their benefits, Medicaid appeals, all the stuff that used to mean 3 or 4 bus rides for seniors or hours in a waiting room. We want to cut that. The quiet part of this that really excites me the most is that every time your staff or you sit down with a resident for a minute or two to help them of our technology benefits, it helps them be a little bit more independent, and that's the real win here. So here's what I need from you to get started. It's honestly just 3 clicks and 1 signature. There's going to be a short 3-minute survey, just so that, really for my notes, so I know how you're using the technology. How you think it will benefit your community. Nothing fancy. It's for my own project data so that I can use this towards my degree. I'll have a 1-page user agreement. It will also be linked over to your email, and it clearly states that the devices in your building, you are responsible to take reasonable care of them. And the most important part, though, is that we are not holding anybody financially liable if the hardware is damaged, lost, or stolen. We will not send any of the communities a bill for this. This is a donation. However, we are going to retain ownership in case the communities aren't using them and other communities would like to use them instead. That's basically it. You can plug them in, hand them out. Let me know. In each building, we want to have 1 staff member dedicated as the Health Hub operator, tech champion, basically to make sure that the hardware is charged and stored securely. And that's it. It's really pretty simple. So I already have a couple of sites running that are fully onboarded and using the hardware in their communities. There's one woman in a refugee shelter using this to study for a paralegal degree. Multiple residents are using it for things like mobile court and telehealth visits already. One resident we found had a $2,500 medical overcharge on a bill that she was able to scan to us securely through the portal that we put on the tablet. Our AI team audited it and found that they hadn't even billed the insurance yet, and we were able to get that appealed. So we want your residents to have the same win. So if you can knock out the survey and the agreement ASAP, as soon as those 2 things are done, I'll schedule a one-on-one with you to go over how you're going to use it in your community and make sure you have all the right software and get you started. So any questions at all, please reach out to me by phone or email, and thank you again for trusting me with this.